What happens when you eat too much saturated fat? Consuming a lot of saturated fat found in beef, pork, butter, cheese, and whole milk can be stored as excess fat, causing rapid weight gain. Saturated fats are saturated fatty acids with a fairly stable chemical structure, usually solid at room temperature. They are abundant in beef, pork, butter, cheese, whole milk, and dairy products, coconut oil, palm oil, and cocoa. Many processed foods, such as candies, fast food, and fried foods, can also contain large amounts of saturated fat. Consuming too much saturated fat is not good for health. Saturated fat has a high calorie value, 9 kcal per 1 gram of saturated fat. When consumed excessively, it is easily stored as excess fat in the body, leading to weight gain, obesity, and related health problems. A diet high in saturated fat can increase the risk of insulin resistance, a key factor leading to type 2 diabetes. Saturated fat can stimulate chronic inflammation, affect the function of pancreatic beta cells, and reduce insulin sensitivity in the liver, muscles, and fat tissue. When the body cannot use insulin effectively, initially the pancreas produces more insulin to compensate. But over time, this reduces pancreatic function and increases chronic blood sugar levels, causing type 2 diabetes and a high risk of obesity and overweight. Saturated fat raises LDL cholesterol, bad cholesterol levels in the blood, forming plaques in the arteries, causing blood vessel blockage, and increasing the risk of cardiovascular diseases such as heart attacks and strokes. Excessive consumption of this fat can reduce HDL cholesterol, good cholesterol, leading to lipid disorders, increased risk of atherosclerosis, heart attacks, and strokes. A diet high in saturated fat can trigger chronic inflammatory responses, affecting the development and progression of cancer cells. The amount of saturated fat should not exceed 10% of the total daily calorie intake. To reduce the negative impact of saturated fat, people should prioritize lean meats, use vegetable oils instead of animal fats, and choose low-fat or fat-free milk. Food preparation methods can directly affect the amount of saturated fat in daily meals. Therefore, instead of frying with a lot of oil and fat, try grilling, boiling, steaming, using an air fryer, and limit the use of animal butter and creamy sauces.